people don't understand that when you put meat tenderizer on your meat to tenderize your meat to make it more edible, that people don't understand that their body is made of meat. And it floors me because, you know, going back to the story about my mom, here I was just excited about going to these Chinese restaurants because my body wasn't responding to the fact that I'm putting this foreign chemical and, you know, this substance in my body. My body wasn't responding, and now when I think about it, I'm actually jealous of my mom's body because my mom's body was responding right away, and I wish that my body would have responded like that because eating meat tenderizer is bad for you. It's bad for me to take I mean, would you take meat tenderizer and drink it? You probably wouldn't do that, but it's the same thing. If you're going to take meat tenderizer and put it on chicken or on meat and put it in your body's going to absorb that meat tenderizer. And it goes back to me saying that your body knows how to digest proteins, fats, carbohydrates, minerals, and substances from the earth. But when you put in these man-made toxic chemicals that we're utilizing to make things more efficient, it goes back to, again, once again, we're trying to make things easier on ourselves, to make it easier for us to eat the meat. So we put meat tenderizer on it. We try to make it easier for us to taste an orange drink, so we make these orange drinks made of chemicals, chemical flavoring, chemical coloring, and we drink these chemicals. And we think that our body has the ability to like excrete these chemicals. And for the most part, it does. But a lot of times, it doesn't know how to excrete a lot of the chemicals, and these chemicals are stored. And these chemicals, which I call toxins, are stored in fat. Most toxins are stored in fat. And this is really interesting. And if toxins are stored in fat, then what happens is, if you know about, there's a way that your body basically breaks down, you know, fats, carbohydrates, and proteins. And if your body, if you're working out and you're trying to lose weight, and you've put on weight, and your fat is now toxic, and that's where the body has stored its chemicals, the Krebs cycle, which is the way your body's supposed to be utilizing fats and sugars to produce ATP for energy. ATP is, you know, basically adenosine triphosphate, which allows your body, your cells to get energy to utilize the energy, and your body needs that. The Krebs cycle doesn't work the way it's supposed to work when your body's toxic, because initially your body's supposed to be utilizing sugar for energy. Well, when you have insulin resistance, your body's not going to be utilizing the sugar properly. And then after the sugar's used, your body is supposed to go to fats, to utilize fats and break down fats to produce ATP. But when your fat is toxic, your body can't utilize the fat properly. So your body then goes to proteins. And when your body breaks down proteins, that's really not the goal. Your body breaks down proteins, and then it becomes catabolic. And if you break down your proteins, then your body is going to disturb your body's metabolism and slow down your metabolism. So, I mean, there's so much science behind this, and there's so many hours that we can go into each subject, but the bottom line is that there's an accumulation of toxins, there's an accumulation of stress that's affecting your body, and then it results in the end with a symptom. And just because you're obese and you come in and you see me, you know, and you're coming in for pain, and sometimes when I'm looking at this patient that's way overweight and they're coming in for their lower back pain, you know, they don't want to hear that they're overweight. They know they're overweight. They want you to tell them what you can do to just treat the pain. I don't want, you know, they're like, I don't want you to tell me I'm fat, because I'm here to to get rid of the pain. And yeah, we can get rid of your pain. We can chemically, we can fight fire with fire and treat your lower back inflammation with a chemical that's going to decrease your inflammation. We can use a pharmaceutical to do that, or we can use an ultrasound therapy, an injection, or we can do surgery, you know. But that doesn't change the accumulation of stress that's ongoing in your body. But so what do you do? You're like, well, what do I do? The first step is to eliminate the toxins, to be conscientious of these toxins that you're putting into your body, and to make the change to slow down or stop. You know, it's tough to stop because we're breathing in toxic air all the time, but at least we can make specific changes to slow down the amount of toxins that we're putting into our body. And when I tell my patients, or when I tell even my staff, you know, people think I'm crazy all the time because they're like, oh, Dr. Lohr, he's this health nut. But when I'm telling them not to eat, not to be drinking the Cokes, or not to be eating the French fries and stuff like that, I'm telling it to you guys from the bottom of my heart because I care, and because I know what's going on. I know what's happening to your body. I know from a chemical, from a physiological level, how your body's going to respond to that, and the long-term degenerative conditions that are going to come. And I see it every day. And I think that when you see as many kids coming into the clinic now with these conditions, you know, it used to be like, oh, you'll get it when you're 50 years old. You'll get your heart attack when you're this age. You'll have cancer, you know, in a long time from now. But when you see all these degenerative conditions occurring at younger and younger ages, it's time for us to do something about it, and it's time for us to, you know, to learn about what we can do. And once again, I have to say, it starts with one person. It starts with you, and you need to make that change in yourself so you can help out other people.